attention, and serves as a blueprint of engaging communities in health literacy. Dr. Murji is a lecturer at the University of Toronto, where he has created a novel health equity curriculum for resident physicians. Based on the tenets of experiential and transformative pedagogy. He is the founder of the non-for-profit organization Stand Up for Health, which delivers impressive learning experiences to train healthcare workers in health equity and advocacy. By night, Dr. Morji showcases his artistic flair as the lead vocalist of the indie alt rock band Parachute Thieves. Without further ado, please help me welcome Dr. Morji. Dr. Morji, whenever you are ready, please take the floor.
Okay, thank you, Hannah. So I'm going to now share my screen. We're going to get started. Okay, can you all see the slide deck? Yes?
Yes.
Okay. So we're going to get started. So today we are talking about measles. And measles is a hot topic in our community right now because there's an outbreak. And this is very serious. People can die from measles and it's completely preventable. So it is very important that we're all up to date on understanding this disease and how we can stop it and everything we can do. So just a little bit about me before we get into it. I just want you to know that the VaxFax Plus clinic, also known as Health Facts right now, is a clinic that I'm the lead physician of. It's a partnership between SCHC and SHN, so that's Scarborough Health Network. And this is a place where if you have further questions, you can speak one-on-one with a physician, that would be me, over the phone in a confidential, anonymous fashion and get any questions you want answered about any vaccine or any health topics, really. So that's available for you. And we encourage you to use it because why not? So without further ado, let's talk about measles. So you're all here for measles. What is measles? Well, it's been around for a long time, and you might not have heard of it in a while, but now it's making this resurgence. It's actually a very, very contagious viral infection, and it spreads through the air. So coughing, sneezing, breathing the same air, these are ways that you can get it. And you don't even need to be in the same room as the person who has measles because they could have left an hour and a half ago and the virus lingers in the particles in the air for up to 2 hours. So it's extremely contagious. And this is more contagious than COVID, okay? So just to give you an idea of what that's like. So this is why it becomes a public health focal point when there's an outbreak. And really, all of this stuff is preventable. Okay, I'm going to reinforce this idea a lot, is that this is completely preventable. So let's prevent it. So what are the signs and symptoms of measles? Well, it looks initially like a typical viral upper respiratory illness. So you could have a fever, so that's 38 degrees Celsius or about 100 degrees Fahrenheit or up. If you're getting that on the thermometer, that's a fever, okay? A cough, usually it's like a dry cough, a runny nose, or your eyes are red and itchy. We call that conjunctivitis. These are the typical symptoms at first. But then a couple days in, then you could start seeing something called Koplik spots. And this is inside the cheek. You get these little white spots. And then later on, you can start getting this rash. And it typically begins around the hairline and it goes down to the face, to the neck, and throughout the body. So it spreads downwards. So this is the classic measles rash. So these are reasons to think you might have measles, but hopefully you never get it because we prevent it. But just for you to know more things about what it looks like. So there's actually the timeline of the illness is very important because it helps you even understand why it's so contagious. So there's an incubation period where you have this virus and it can be 6 to 21 days. So it could be up to 3 weeks that you have measles, and you can even spread measles without even knowing that you have it, because symptoms can appear after that. So that's a huge reason why outbreaks can be very hard to contain, and why public health interventions are important, and again, why prevention is so important. So then once you finally have symptoms, this is about 2 to 4 days, where you can have fever and the cold symptoms, as I mentioned, the runny nose, the cough, that kind of thing. And then you have this rash that appears around day 4. As I mentioned, it travels downwards from your forehead down your body. And you're contagious 4 days before to 4 days after the rash onset. Okay, that's when you're most contagious. So now you're starting to get a picture of what measles looks like. So now, why do we care about this? How dangerous is this? So what if you get it? Well, first of all, it's completely preventable. So why have that in the first place? But secondly, the dangerous part is not all the symptoms I told you about. The real danger is all of the complications that come from measles. And all of these complications are even worse if you are someone who is like a baby or immunocompromised for whatever reason, right? So 1 in 10, so that's a pretty high number, can have ear infections, and you can have hearing problems from this. 1 in 20, which I think is a very high number, can have pneumonia, and you can be hospitalized for this. And this is actually the leading cause of death from measles. 1 in 1,000 can have encephalitis. So this is where your brain is inflamed. So you can imagine that's a very serious condition. And from 1 to 3 in 1,000 people actually end up dying from the complications of measles. So this is a very serious uh, condition. In Ontario, I'm going to tell you more about this later of what's going on, but we've had already, it's April, we've had 900 cases this year, and that's the most we've had in the past decade, and we're only in April. And out of those, 70 have been hospitalized. So this is something serious, and because it's preventable, we don't, we especially don't want it. So how does it spread? So there's a little bit of a technicality here that I'm going to explain to you, and it's going to be very easy to understand in a second. So this thing, R0, this is called the R naught. And every infection has this kind of figure attached to it. In this case, with the measles, it's 12 to 18. So that means that for every individual who has measles, they will infect between 12 and 18 people. So you can imagine then those, let's say, 16 people who get measles from the first person, now they go to infect another 12 to 18 people. And so it spreads like wildfire. So this is super contagious, and that's why we need to get it under control ASAP. Because soon you're at 1,000, and then as you know, 1 in 1,000 people are dying from this, right? So that's a tragedy that is preventable. And why does it spread so easily? As I mentioned, huge incubation period before symptoms even begin. And this spreads through the particles in the air. And as we said, it can last in a room for even 2 hours after someone's left a room. So this spreads more than COVID, okay? And if you're unvaccinated, there's a very high likelihood that you will get infected if you are exposed to this. Over 90% chance. So it's super contagious. And think about places where it would spread. It would be like schools, daycares, malls, the places where people congregate, especially places where people have weakened immune systems. So we need to prevent this. So, if you suspect that you have measles, or your child has measles, or loved one has measles, do not just show up into the clinic or ER. It's good to it's good we have phones, right? So we can make a call and talk to a provider. You can even call VaxFax, that would be calling me, and we can walk you through the steps of what to do. But get in touch with public health, call telehealth, call your own doctor, right? And just let them know, give them a heads up that you have the symptoms of measles and why you think you might have it. And if you're going out, you should definitely wear a mask and avoid public spaces. But because you're listening to this talk, you will not get measles, right? Because we're going to prevent measles. It's actually very easy to prevent this. How? How do we prevent measles? Well, there's a vaccine for that. And it's been around for a really long time. It's very safe, very effective also. You might have heard of it. It's the MMR vaccine. The M is measles, the other M is mumps, and the third and the third letter, the R, is rubella. So you need 2 doses of this to be fully protected. And even getting 1 dose, you're already 93% of the way there. Okay. So everyone should have 2 doses at least of MMR. When you're at 2 doses, you're fully vaccinated. And I think I said this already, but like 90% or more of patients who end up with measles are people who are unvaccinated, right? So you might see, like, you might be wondering how come at 2 doses you're like at 99%? Why isn't it 100%? Well, that's because nothing is 100%. So you could get a million vaccines of the same thing, and it's possible that your immune system, if you're like a unique individual, because no one's exactly the same, that you just are not mounting an immune response. But if everyone else is getting vaccinated, then overall everyone's getting protected, and then measles is not bouncing around, and then you're protected, which is why vaccination helps everyone. And you should do your part because you don't know how your immune system is going to respond. So hopefully it responds robustly, strongly to a vaccine, and you have a lot of antibodies or immunity to this virus. So in Ontario, how do we do this? Well, at 12 months of age, at 1 year, you get your first dose. So every baby who's 1 year old, generally, they're getting their first dose. And then you get a booster, and the booster isn't the MMR, it's the MMRV. So it's kind of the same thing plus the varicella vaccine, which is like for the chicken pox. And you get that at 4 to 6 years. So that's the typical schedule in Ontario. And other provinces have it a bit different, but this is what it is in Ontario. And if you ever miss a shot, there's a catch-up vaccine. You can get all this at other ages. So if you're a parent of someone who might have only have 1 shot or even zero, yes, the good news is you can get both of these now. We can solve all your problems around this. We just need to talk about it. All right. So get in touch with me or your provider, and we can get moving and catch your son or daughter up. Now, there are some special cases that you might be wondering. So I'll just preemptively answer this question, which is a popular question. What if you have a baby and they're, let's say, 8 months? They're not at 12 months yet. So usually we don't vaccinate until 12 months, right? As I just told you in the last slide with our routine schedule. However, now because there's an outbreak, and if you're going to an area that has a higher prevalence of measles, or if you are living in a place that has more measles going around and your public health unit has made an announcement about this, then you can have your baby who's less than 12 months, as long as they're greater than 6 months, they can get an early MMR vaccine. Okay? So that first dose, that MMR, they can get it before 12 months, but they still need to get the 12-month dose when they become 1 year old. Okay, so it doesn't count as their first dose. It's just an extra dose that they can get early to protect them. But they still need the typical 2 doses at 12 months and 4 to 6 years. Okay, let's keep going. So, as I mentioned, why are we having this talk right now, right? It's because there is an outbreak. And why is there an outbreak? It's because people aren't getting vaccinated. So now we have over 900 cases in Ontario just this year, and this is more than we've seen in the past 10 years, and we're not even halfway through the year. So this is getting out of control, and a lot of people are getting hospitalized, 4 in the ICU. So that means people are on life support, right? They're very serious condition. All of this is preventable, right? Over 95% of our cases are people who are unvaccinated. If we had a full vaccination rate, like 100%, it is very possible that we would have like almost 0 cases. Okay, there's something called herd immunity, which you may have heard of. no pun intended. But if everyone is vaccinated, then it's very hard for things to spread. So then even if somehow someone gets measles, let's say they are, let's say there's 100% vaccination, but then like one of those people, even though they got vaccinated, their immune system didn't create a response. Well, then that person is susceptible, and somehow they get it. They would have to be in another population to get it. But then they come into this 100% community that's vaccinated, and then they can't give it to anyone. So it just kind of dies up. So that's called herd immunity. So you protect each other by vaccinating yourselves. So you're protecting yourself, but then it has a side effect of protecting the community. That's what we want. That's what we had for a good amount of time. And now, because the vaccination rates are too low, here we start having outbreaks. These are all preventable. So, as I mentioned, who needs this vaccine? Well, we know that children need to get to 2 doses by the age of 6 latest. Adults who are born after 1970 should also have their 2 doses. If you are born before 1970, you do not need the measles vaccine. And that is because before 1970, there was so much measles going around that everyone generally has already been exposed to it. And being exposed to it creates immunity. So, almost universally, when you do a blood test of someone who's born before 1970, what they found is all of those people, their antibody levels to measles uh, shows that they're immune already. So we do not need to vaccinate people who are born before 1970 unless possibly they have like immunocompromise or some very special conditions. Okay. But if you're born after 1970, you should make sure that you have 2 doses. And if you are a traveler or a healthcare worker or student, you're a higher risk group and you should like make extra sure that you've had your vaccines. Okay, so this is something to look into, like check your records and double check that you've had MMR and a booster of MMR or MMRV. And keep in mind the MMRV, the V was implemented, I think, in the late 90s. So for people who are kids before then, they wouldn't have had the varicella part of that, and that's fine. It doesn't matter. What we're talking about right now is the measles, right? And just so you know, because maybe this has triggered a question in your mind, is the V, the varicella, you probably got chicken pox at some point, so you don't need to chase that down, okay? But again, if you ever have questions, you can ask. So, is this MMR vaccine safe? I mentioned the answer is yes. I will now reinforce that the answer is yes. It is very, very safe. We've been using this for many, many, many years, decades, and millions of people have had this vaccine, and we know that they're safe because of that. The common side effects are like you might have a sore arm at the injection site. You might feel a little like nauseous or a little fever, just a little tired for a day or two. But a Tylenol can help with that. And even that, most people don't even really feel that. Okay, so those are the most common side effects, but they're not even that common and they're very mild and they're controllable. Um, this last point, it is sad that I even need to make it. Um, because this idea of autism being linked to vaccines is completely made up. Okay, so I want to reinforce this idea is that a long time ago there was someone who who said that there was a link between autism and vaccines, and it turns out that the study that he did was fraudulent. It was fake, and he got in trouble for this after. But the damage was done because this idea, this made up idea, was put into the world, and now it's caused like a wave, a ripple effect, and now people believe this and have made up their own related ideas, but there there is no link at all, and vaccines are totally safe. So we can move on from that one. Okay, so what happens if you missed a dose? Well, you can catch up. we talked about this, you can get a vaccine or any of these MMR vaccines, you can get this for free in Ontario. So you don't need to worry about coverage. Toronto Public Health can provide this for you or any public health jurisdiction, or you can call VaxFax, you can talk to your doctor, you can even get this in a pharmacy. So just make contact with the health provider and we will figure this out for you. But first take a look at your records so that you know where you're at, how many doses you've had. I mentioned this as well, but just to hammer it home is that you will protect yourself by getting vaccinated, but you will also protect everyone around you, including the weakest and most vulnerable people in our community. So that's immunocompromised people, babies who are too young to get vaccinated because their immune system's not mature enough to get the vaccine yet. And less people will get sick. That's great. There's less suffering in the world, and it even saves money because we don't need to be having our hospitals that are already packed, even further overwhelmed with patients from a preventable illness. So where do you go to get your vaccine? Your primary care provider should have this. MMR is a very basic and standard vaccination. Even walk-in clinics have it. Some pharmacies have it. Toronto Public Health has special clinics where they do these vaccines. And then you can call 211, you can call VaxFax again. I can help you find this and give you more information. But this vaccine is very widely available. It's very common. And so, yeah, it shouldn't be hard to find it. Okay. So I just want to remind you that the VaxFax clinic is where I am coming from. We call it the Health Facts Clinic now because we talk about more than just vaccines, and you or anyone you know can book on this website here, shn.ca/vaxfax, and you can speak with me one-on-one. You can be anonymous if you want, and it's a judgment-free consultation where I can answer any of your questions about health or vaccines or anything related to health. So yeah, make use of it because it's available for you and it's free. Okay, so I hope that you understand now that measles is dangerous, it's spreading fast where we live, and MMR is a vaccine that is very safe, very effective. It prevents you and the rest of our community from getting measles. So we need to take action on this. And let's educate each other as well. So thank you. And this is your chance to ask questions. And if you are shy, that's okay because you can just ask them one-on-one if you book. So I'm opening it up to questions.
Thank you so much, Dr. Latif, for this amazing presentation. I already shared the Vax Facts, or also known Health Facts clinic link in the chat. So in case anyone needs more information, they can book an appointment with you. And thank you for having this opportunity here. And now we have some questions. I need just to post them to you to answer. If an adult has only one dose of MMR vaccine, is he or she eligible for a second dose?
Yes. Yep. If you are an adult with one dose of MMR, you should have 2 doses of MMR because there's no reason to just have one. That means that you're born after 1970 because if you were born before 1970, you wouldn't have any dose. So that means you should get your second dose. And you can get it at
Now,
all the places that I mentioned.
it's a similar question, but here we are talking about necessity. If adult received one dose of MMR vaccine, is it necessary to get a booster?
Yes, I would say it is necessary because you are, let's say, like remember the stats that I showed you. You're walking around at 93% protection when you could get to 99. So why risk it? Like why risk having a 1 in 20 chance of pneumonia or 1 in 1,000 chance of having brain inflammation and death when you could get a vaccine that's free and safe and effective, and it just is a prick in your arm for a second, and it will basically make your chance of getting measles practically zero. So you should definitely get it.
Yeah, thank you. If a child has two doses outside of Canada before they turn 2 year old, do we need booster when she or they turn 4 as per Ontario guideline?
Yeah, so if they have had two doses, but both of the doses are before the age of the booster in Ontario, I would have to double check that one. That's a unique case. So feel free to uh yeah, just book in with VaxFax and we can review that one together.
Yeah, please, just the link of the
Yeah, let's just
VaxFax.
yeah, is the link in the chat?
Yeah, it's in the chat, so please book an
Okay.
appointment. It's free, available
Yeah.
for everyone for free, and you can book any time it's available for you. You can choose from the calendar which date and time, and you can book. It's very easy.
Mhm.
Another question: if someone already had measles and cannot remember if they have taken MMR vaccine, is it still recommended to get vaccinated?
They've had the measles infection?
Had measles and cannot remember if they have taken
Yeah.
MMR vaccine.
Okay, so okay, let me say okay. So in this case, if they had measles, then presumably they are now immune. Okay. So they probably do not need the vaccine. But why did they have the measles, right? Like the question that is in my head is like these types of questions, it would be helpful to know like the age, past medical history, like who are we talking about? Are we talking about a 4-year-old kid or are we talking about a 70-year-old adult? Is this someone who has other medical conditions? These kinds of things. So it changes a lot, right? So one is if you want to ask these types of questions, provide me with this information because the context matters. Secondly, because the context matters, some of these questions are better answered in a one-on-one kind of call. It also protects your privacy. But thirdly, to answer your question, yeah, if someone, what was it again? If they had measles before, do they need vaccination?
Yeah,
Um, Generally, if you've had it, you do not need to be vaccinated. But again, I can't even say that for sure because I don't know why they got it in the first place. Are they immunocompromised, et cetera, et cetera? And probably this is not the best place to discuss these types of things about a certain individual. So I would highly recommend, this is why VaxFax exists, is for us to talk about these types of cases. Like this is someone who got the measles, right? This is not it's not, everyone who gets measles. Unless we're talking about someone born before 1970, then literally everyone got the measles. So again, very contextual.
yeah, thank you. A baby is turning 1 year old in May 16. She asked me if she can vaccinated her child in the SCSC clinic next Friday.
Yeah. So yeah, so they're turning one like or they're reaching this 12-month milestone within a month. So then really, yeah, definitely they can get vaccinated next Friday, right? Like we even said between 6 months and 11 months, yes, they are eligible. The real question is actually like kind of a technicality of whether this will count as the 12-month vaccine or not, or whether it will count as the early dose, right? And so that's actually probably a public health thing. But either way, I would recommend get it, get the vaccine. There's no harm in it, and it's safe and effective. And then we can figure out later about whether this will count as the first dose or whether this is the extra dose that's meant for babies who are between 6 and 11 months who are possibly traveling or entering an area where there's a higher level of measles in that community.
Yeah, thank you. Why is there a resurgence of measles after the 19th? Is it because we haven't caught up on vaccination rates due to COVID pandemic?
Resurgence after the what? I didn't hear that part.
1900S, 19th. Minusha, you can,
1900, so that's the 1900s.
Yeah,
So do you mean the
Minusha,
1990s?
Minusha, you can explain
Sorry, I
more if
meant
you would
before
like. Yeah.
like the 1970s.
You meant after the 1970s?
Before.
Okay, so the number 1970 is because there was no vaccine for those people who were born before 1970. So back then, there was no MMR vaccine, and everyone just got the measles, and some people died, etc. But, you know, the people who lived are all immune to measles. So if you take like my parents who are born in the 50s, for example, and you draw their blood, which we literally did, it shows that they're immune. So everyone who, like, generally speaking, almost every single person born before 1970 is already immune. So we just don't have to worry about those people for measles vaccines. However, now as time is progressing, a greater percentage of our population, the majority of our population, is born after 1970. And why is there a resurgence? That's also part of your question is that let's say between 1970 and like 1990, those 20 years, like the people who are choosing to get their kids vaccinated, those people are like my parents, let's say. They knew other people who got really sick. Like, again, a personal example. My dad's sister had polio. Okay. So they actually were like, yeah, I don't want my kid to have this. So people were like scared and they actually had this like incentive to get the vaccine. And then they're like, wow, this is amazing. Like it's safe and effective. And now my kid is protected from all these dangerous viruses. And we had this generation of people who like there wasn't measles going around. And then now we're like in the 2000s and the 2010s, in the 2020s, and people forgot that measles is even a thing, and people become complacent, and then they're like, oh, and then they hear about this fraudulent study about vaccines causing autism, which is made up. And then there's a movement of people who are against vaccination, or people who are not informed, or people who are not like noticing the measles going around or whatever, and don't have an incentive to vaccinate. Therefore, there's a higher percentage of kids in schools who are unvaccinated. So then when one case arises, we know this is super contagious, boom, suddenly there's an outbreak, and almost every single kid who gets measles is one of the kids who was unvaccinated. So now we're doing this, which is giving information so that people understand the importance of these vaccines, and people can, hopefully hear it from an expert. Whereas, who knows, like 50, 60 years ago, maybe people just trusted experts. It was a different climate at that time.
Yeah, thank you. Another question. What should I do if I am unsure whether I am immune to measles?
Yeah. So again, I don't know your age, but I'm assuming you're born after 1970. Uh, and that's why you're asking this, because if you're born before 1970, you can assume that you are immune. If you're born after 1970, you should check your vaccination record. If you do not have a vaccinate, like if you are unsure after looking at your vaccination record, then you should probably just get vaccinated. Or you could check your titers, which means we do a blood test to see your antibody level. But if we're going to poke you for the blood test, we might as well vaccinate you. So those are your options. So you can talk to me about it, you can talk to your doctor, but ultimately, if you look for your records and you can't find this in your records, or you can't find your record, you could just get the shot because it's safe and effective.
Yeah, sure. Thank you. How effective is the measles vaccine? I think you mentioned that in the presentation.
Yes, I think it was one of the early slides. So first shot gets you at 93% effectiveness, and then with two shots, you're at 99%. So extremely effective and extremely safe.
Yeah, thank you. How long does it take for the measles vaccine to work in your body?
Yeah, the measles vaccine is just like, almost every other vaccine, in the sense that it triggers your immune system to generate its own antibodies, right? So in the first couple days, your immune system is like, whoa, like what's this? We need to start creating a defense against this thing. And the thing that's introduced to your body is not a harmful thing, right? It's just like let's say it's like a mimic of the measles virus, but it's not the real thing. So then your immune system starts developing. It's like an army that starts making soldiers, many, many, many of them. These are your antibodies. And this takes, let's say, a week to 2 weeks for it to really get at like full capacity to build the entire army of soldiers or to get all your antibodies, 100% at the peak level in your body.
Yeah, thank you for this very detailed answer because it also answers the following question. Uh, how does the measles vaccine work? I think you
All right, there
get
we
into
go.
depth into that.
Nice. Yeah, perfect.
Yeah. Could I still get measles if I am fully vaccinated?
Yes, so anything is possible. Literally anything is possible, right? So you could, but it's extremely, extremely unlikely. If you are vaccinated, you're 99, you're even more than 99% covered. Okay, so all the best you can do is get the vaccine, and then that's it.
What about the symptoms in this case?
Oh yeah, and then yeah, even if you get it, it's very possible that the symptoms would be milder. You're less likely to have complications. That's a good follow-up as well. Because even let's say you got the vaccine and then you still got the measles somehow because you're like the 0.01% uh, of that. That means that your immune system didn't respond enough to the vaccine, but it still would have responded somewhat. Like you would have some level of antibody, which would still help you, right? So let's say you don't have the full army that almost everyone else would produce from this vaccine, but you have some army, and those soldiers will still fight the battle for you, and you will still like have less damage done because you have somewhat of an army there.
Yeah, great. I have been exposed to someone who has measles. What should I do?
Okay, so let's go to this slide because I don't want you to, I don't know how serious you are about this or how timely this is. So let me just find this. Uh, okay, so to the person who asked this question, uh, don't walk into a clinic or ER unannounced, right? So put on a mask. You are contagious, right? Um, like you need to make sure that you don't have the measles. I guess if you're exposed to someone that you know had the measles, like you should probably, the first thing you should do is call public health, right? Toronto Public Health if you're in Toronto. And you should not, like, you should just assume that you have it for now. So you need to isolate and you should call public health because they will want to do contact tracing and they will give you proper advice. But as we said, this is super, super contagious. If you are unvaccinated, then the chance is very high that you have the measles from this exposure. If you are vaccinated, then great job. But still, you should call public health and get their advice on what to do next. And you should isolate in the meantime.
Great, thank you. I think I have measles. What should I do?
Okay, so we just kind of went over this. So I guess the question before this was, I think someone that I've been exposed to has measles, and this one is, I think I have measles. Well, again, so now it's just all the same things, but it's even more urgent. Uh, you should isolate, wear a mask, avoid public places, call public health and tell them, what's going on and call your own family doctor. You can also call me and I can help you out. But don't just show up in any public space because if you do in fact have measles, you are super contagious. And also like hydrate, like rest and drink water and take Tylenol as needed if you have a fever.
Great. So it's very useful to have all these recommendations in mind if we are getting in touch with people who are having measles, or if we suspect that we have measles, or even if we have measles itself. So it's a very good idea to have a look at all these details to keep this, let us say, outbreak under control. I think here I have some question related to wild type measles. What do we know about this type of viruses?
I don't understand what
Wild type measles.
so I don't know what I don't know about this, and you can feel free to book in with me and we can talk about this. Because I don't have the comments up. But feel free to, if there's something that I can't answer today like this, we can talk about this on VaxFax appointment.
Yeah, absolutely. Thank you so much, Dr. Latif. As I mentioned earlier, the link to book an appointment with you is already in the chat, so please feel free to do it. It's free, it's available almost all the time. You can choose your date, your time according to your availability, and it's very easy over the phone. All details will be absolutely secure on one-on-one conversation, right?
Yes.
Any other question from participants? Please feel free to share before closing up. Nothing more. Again, if you have any questions after we are finishing this session, please feel free to get in touch with Dr. Latif via VaxFacts Plus. It's available for free.
Yes. And thank you to SDHC and SHN. And yeah, we have some very strong health institutions in Scarborough, and we have this vaccination clinic. Is May 16th? Is that right? Or
Friday
sorry,
and
no,
Saturday.
no, it's a Friday.
Yeah, Friday and Saturday,
It's-
April 25 and April 26. Yeah.
Yes, exactly. Awesome. Yeah, so, if in doubt, you could literally just go to the vaccination clinic. But again, you can just book in with me. We can figure out your personal issue and spend more time on you one-on-one. And, it's an opportunity available for you. So feel free to utilize it.
Great. Thank you so much, Dr. Latif. We want to give you a huge thanks for taking the time out of your very busy day to present such valuable information to our community members. And thank you so much all for having the time today to participate in this very useful presentation about measles. Your feedback can help us improve. We will be asking a few questions that need your attention to be compared between before and after the presentation. Your feedback is appreciated. Also, if you would like to enter into a gift card draw, please share your email address. I will be sharing the link with you. It's very easy. You can just do it right now while you are with us, or maybe in a few minutes.
I'm going to stop sharing my screen now, okay?
Yeah. So the form link is already in the chat. Please feel free to complete it. And as I said, if you are interested in entering a draw for gift card, please feel free to share your email address via the link, which is already in the chat. Thank you again, everyone. Have a great evening and good night.